A recent study identified 3 key objective measures to determine if a person is likely to have a low back pain issue. And we're going to talk about them next on this back and body video. Hi, Dr. Dave Perna here, chiropractor with Back and Body, your collaborative care approach offering chiropractic, physical therapy, acupuncture, and medical care to the people of Midtown Manhattan, New York City on 58th and Lexington, as well as in Springfield, New Jersey on US Route 22 East in Springfield, offering our services to the people of Union County, which includes Summit, Springfield, Milburn, Westfield, Garwood, and Cranford. Today's study looks at 12 articles. It identified some key objective measures that would tell you if a person is more susceptible for having low back pain. These 12 articles looked at the risk factors and objective measures of 5,459 people. This study basically tells you, listen, if you have these objective measures as a clinician, you can identify people who have risk factors from suffering from low back pain. Now, low back pain is the second most common reason a person misses work, next to the common cold. So if you can identify someone who's susceptible to having a low back pain episode and attack it before it's a problem, you can avoid low back pain. So what are the 3 things that this study, looking at over 5,000 people, over 12 articles of research, determined to be 3 easy things to identify by a clinician? And you can actually do this yourself too. The first is restriction with lateral bending or side bending. Now, when I see a patient, I go through ranges of motion or the lumbar range of motion. When you do side bending, it's key to make sure you understand that you're bending in the low back. I will see people compensate by moving their shoulders or moving a leg to bend, but not moving the low back. To me, that tells me the person has low back pain for quite some time, has been compensating for the problems of restricted range of motion and lateral bending, or what commonly known as side bending. The second most common thing is hamstring or hip flexion range of motion. This is an easy one to test. You lay on your back on the floor on your bed and you bring your leg in a straight motion up towards you. We typically like to see someone achieve 90 degrees. That's a 90-degree angle between their upper body and their hip as a result of bringing the leg up straight without bending the knee. Typically, people with tight hamstrings are more susceptible to low back pain, and we've seen this ourselves clinically over the last 15 years. When a person has tight hamstrings, it pulls down on the bottom of the pelvis. So when they flex forward, the pelvis isn't able to rock forward and allow more range of motion. All the range of motion now has to take place in the low back. This makes a person more susceptible to low back injuries, or just increased wear and tear in the low back, which will slowly lead to a low back pain episode. The third thing is a decrease in lumbar lordosis. Now, to understand lordosis, it's basically the small of your back. So if your stomach is here and your backside is here, the curvature of your low back, if you were to put your hand behind you and feel your low back, that is lumbar lordosis. They found that people with a decreased lumbar lordosis were more likely to have a low back pain episode. Identifying these 3 things had a high causality for low back pain. So they encourage clinicians to use these 3 markers as screens for people to determine if they're susceptible to low back pain. You yourself can use those same 3 markers to see if you are susceptible for low back pain. And if you are, give us a call. We'll tell you things that you could do to help reduce the likelihood by increasing range of motion and flexibility. For more back pain updates such as this, please visit our website. If you're in New Jersey, backandbodynj.com, and if you're in the New York City area, backandbodyny.com. Of course, you can always just like our Facebook pages, for New York and New Jersey, where we post videos and health updates such as this on a regular basis. We'll see you soon.